1 year to the day since enrollment began for Obamacare, healthcare.gov. As the anniversary hits, the law is taking another beating. A court ruling saying the feds cannot give subsidies in states that did not create their own exchange. It's a huge decision with wide implications, with 36 states taking part in the federal exchange. I want to talk about this now. Melissa Francis, host of Money with Melissa Francis, and Dr. Mark Siegel, member of the Fox News Medical A-Team and professor of medicine, NYU Medical Center. To both of you, Money, we brought you in to talk about the financial impact, which we will in a moment here. But to the good doctor to my left, we brought you in to talk about how it's affecting you as a doctor and also your patients. 1 year later, what's good, what's bad right now about Obamacare?
First, the good news. 8 million people have insurance that didn't have it before. 4 million of them are Medicaid, by the way, and there's a problem with that because Medicaid is an insurance that's easy to use but doesn't necessarily get you the care you need. The 6 million that were displaced, Bill, most of them got insurance on the state exchanges. Here's the bad news. In the doctor's office, there's havoc going on. You know why? First of all, there are high deductibles with the state exchange plans. High deductibles, meaning even if your premiums are low, and the reason your premiums are low because you're getting a big subsidy, over 80% of people are getting this big subsidy. And in 36 states, it's being contested in courts, probably going to go to the Supreme Court, that these subsidies may not even be constitutional. Assuming they hold, they're coming out of the taxpayer pocket. They're bringing down premiums. But those deductibles are so high that my patients are saying, well, I got this new insurance, but doc, you want me to go for this test, and the deductible absorbs it. I can't pay for that.
So what's the effect of that then? You cannot.
I cannot deliver the care I want. Second problem related to that, I might not be on this narrow plan where they have very narrow networks. So Dr. Siegel might not be on it, or if I am, the specialists I'm used to referring to are saying, no way, I don't want that Obamacare plan. It's not paying me enough. It's too restricted. So doctors are fleeing from it, and then the insurance company may save money by using a very narrow network of doctors. So with a narrow network of doctors, patients don't have the choices they want. They can't get the care they need. They can't get in to see the doctors they want to see. Can't keep your doctor,
I just heard
can't keep your doctor.
1 positive and 4 negatives. Money, what about you? What are you seeing with businesses, with employees, et cetera, 1 year later?
Well, without question, you know, employers are hiring less and they're cutting hours, and that's across the board. There's nothing positive you can say about that. I mean, when you look at the source, the Chamber of Commerce, saying that they went out and they asked their members, 21% of companies that are in the manufacturing business and 17% in the service industry say that they have cut hours, they have fired people, or they have not hired new people as a direct result, they say, of the costs imposed on them for Obamacare, that cost directly offset what they would have paid in wages, and they didn't have the money to pay more. This is looking backwards. This is different from, you know, when companies said this is what we will do, a lot of people said, well, they're just threatening. So this is what has already happened. 1 in 5 companies is cutting hours, wages, or jobs. That's a problem.
Yeah, and we were reporting that more than a year ago. What about Siegel's point? Can doctors afford to stay in the network under Obamacare plans?
No, I mean, that's a great point, and it's about to get worse. The LA Times did an exhaustive survey of this, and as you know, I mean, that's not a right-leaning paper by any stretch of the imagination. They went out and they talked to the biggest providers of Obamacare in the state, and they looked at one company, HealthNet in particular, that's one of the biggest. From 2014 to 2015, they are cutting 54% of the doctors in their network. So that same policy, if you're in California, you just roll over from last year to next year, you will see more than half the doctors disappear. At the same time, the price for that policy is going up 9%. So that's a result of doctors having been in it for 1 year, not making the money they needed, not working out, and they're dropping out.
I'm not hearing a lot of good news from either one of you. We mentioned this New York Times poll, 51% still disapprove. And a lot of this is based on party lines. 83% of Republicans are against it, while only 67% of Democrats do approve it, so that's 2/3. Siegel, go.
I think there's an untold story here that I want to ask Melissa about. I think that it's also affecting the 160 million that are on employer-based insurance, because those policies are changing like wild. They're becoming really skyrocketing premiums. The goal, of course, of the administration is to get more people onto the individual plans on the state exchange. You know how they're doing that? Premiums are really high on employer-based insurance. People can't afford it. Employers can't afford it. To Melissa's point, they're making everybody part-time so they don't have to cover these policies. They also have high deductibles, and they are not useful in the doctor's office.
Let me drive to one more point here. Healthcare.gov, Melissa. Is that price still going up for that website? Or
$2.1 billion and counting, which is really an astounding number. And I've gone out there and I've tried to get numbers. You know, when you ask people in Silicon Valley, isn't that really expensive for a website? And they roll their eyes and look horrified, and you say, well, what does it normally cost? That's not a number that companies even usually track because it's not that huge of an expense. Making the architecture of your website and what goes on behind it never costs $2.1 billion.
You're above $2 billion for healthcare.gov?
For the website and the guts that go into it.
Frank, that's been under the radar for a lot of people ever since we kind of moved away from this and moved to some other stories. Quickly to both of you, do you see any of this changing now?
Now, what I see changing, and Dr. Siegel really highlighted this, and I think it's the takeaway, more people have insurance, but the plan you have is worth less. I think that's true to everyone that's out there. Fewer doctors, costs more, covers less. If you had nothing before, that lesser plan is an improvement. But if you had insurance before, you're furious about this.
I can't say it any better than that, Melissa. I would just add that access is what is key to health care. You got that card, but your doctor isn't seeing you. The waiting rooms are more filled up. You can't get the care you need.
Quickly, do you see anything changing for the better going forward based on everything you
with the poll numbers like that, there's going to have to be some pushback here. Right now, it's to the benefit of insurance companies who are making more money and the government, not to the patient, and definitely not to the doctor. Got to improve that.
Dr. Mark Siegel, Fox News Medical A-Team, Melissa Francis, Money, see 2 o'clock.
2 p.m. Fox Business.
See you then. Thank you, Martha.